I'm Yunus Dudhwala. I'm the Head of Chaplaincy at Barts Health NHS Trust. And thank you for joining us today, where we're going to talk about the COVID-19 vaccines. Here with me today I've got Dr. Anna and Dr. Teresa, both virologists at Barts Health NHS Trust. And I'm going to ask them questions that I am regularly asked about COVID-19 vaccines. So we're going to start. Dr. Anna, Dr. Teresa, welcome. So, Dr. Anna, let's start with a basic question. What are vaccines and how do they work?
A vaccine is any product or drug that stimulates your immune system to make a specific response against a disease. They're designed to protect you from that disease. They come in a few different forms, but the main form is an injection.
Thank you, Dr. Anna. Going to Dr. Teresa. There's two vaccines that have been approved for COVID-19 in the UK, and one is known as an mRNA vaccine and one is an adenovirus vaccine. What does that mean? What is the difference?
An mRNA vaccine is a portion of a genetic sequence from the virus. An adenoviral vector vaccine is that sequence inserted into a defective virus. Neither of them can modify the genome or the DNA of the person that is receiving the vaccine. Both are safe, both are effective, and both are based on the result of years of research that has been done by lots and lots of people around the world.
Thank you, Dr. Teresa, for that explanation about mRNA and adenovirus, because it's something which is really, really confusing. Dr. Anna, I just wanted to come to you and ask the question around safety, because lots of people who are in touch with me are saying, well, these vaccines have been created so quickly. So how safe are these vaccines?
These vaccines are very safe. There were no serious adverse events reported in any of the trials of these vaccines, and the trials included many thousands of people.
Thank you so much. Dr. Teresa, can we be sure that these vaccines work? Because they've not been tested for that long.
They've been tested in a very large number of people, over 40,000 in one of the studies. And not only this, but they've been tested during a pandemic. So these people were exposed to SARS-CoV-2, to the virus, on multiple occasions, and they didn't get infected. So yes, we know they are effective. They were tested in the optimal conditions.
Yeah, okay, but are there any side effects to these vaccines?
Yes, mild side effects like flu-like symptoms and pain in the injection site, but this is the same as with many other very common vaccines.
Dr. Anna, there was reports on the first day about some people having some allergic reactions, and lots of people are asking me, can people with allergies have these vaccines?
Yes, people with allergies can have these vaccines. If you have a history of severe allergies, such as anaphylaxis, you should check before getting your vaccine with the person giving you the vaccine.
Thank you. Dr. Teresa, one of the questions that I get regularly is around pregnancy. So can pregnant women take these vaccines, any of these vaccines, whether it's Pfizer or whether it's the Oxford AstraZeneca? And a lot of people, whether it's men or women, they're asking about fertility, that there is something wrong in this vaccine that will affect the fertility. How true is that?
They're not currently recommended in pregnant women because there's no experience, there's no data to ensure that they're safe, but this might change in the future. And there is no evidence whatsoever to suggest that they have any effect in fertility in men or women.
So what do we know about how and when people will get the vaccine? Because we're trying to vaccinate about 60 million people in this country. How is that going to happen, and how quickly will it happen?
So you'll be contacted when it's your turn to have the vaccine. If you're an NHS frontline healthcare worker, or if you're in an at-risk group, it is likely that you'll have already been contacted.
Dr. Teresa, I mean, people are saying that this vaccine is compulsory, and sometimes people are saying, well, it might not be compulsory directly. They might say, well, if you have to travel, then it's going to become compulsory. What do we know about the compulsory nature of this vaccine? Does everyone have to take it?
No, but you might find that in the future, some of the places you can go to, some of the places you want to travel, or the things that you can do might be somehow limited by having been or not vaccinated. a lot of countries might want to keep their citizens safe and might require a vaccine if you want to go there. And finally, having a vaccine not only protects you, it protects your family and protects your community.
One of the most common questions that I receive is the risk of dying from COVID-19 is minimal. You know, some people give percentages of less than 3% or whatever. Why should we take the vaccine then?
Well, you never really know how you're going to do with COVID-19. This virus may not kill you, but it can also have very long-term health side effects. Also, you might do well, but you might transmit it to a friend or a member of your family that might not. I think the effect of this virus on our lives is evident, and the vaccines are a powerful tool to combat it.
Thank you so much, both of you, for a really, really informative session on questions and answers that I personally have been asked over the past couple of weeks about the vaccine. And I think hopefully the viewers will find it informative. You can find out more about the vaccine and the vaccination program on Barts Health NHS website, and information will be on the screen shortly. Thank you very much.